Hello guys, my name is Annette and the channel is dedicated to all the things I love and care about, and on today's video I'm making a part 2 of my first video called the Leep Procedure. So this is part 2, and the reason I'm making a follow-up on this video is because this is such a common thing so many women go through. Literally 9 out of 10 women will get diagnosed with HPV. Now, what is HPV? Basically it just means it's once you test positive for it, it means that there's a very good chance that could turn into cancer, and you would get cancer in your reproductive parts, organs, you know. And oftentimes when you can continuously keep to get a positive HPV test, depending on the degree of the cells and how abnormal the cells look, the doctor will follow up with the endoscopy, so they can actually get a little sample of your cervix to see how abnormal the cells are. After that, they will go ahead and give you, the doctor will decide whether they want to take part of your cervix out or even do something more invasive, for lack of a better word, or simply just come back in a few months and test again. This is my part 2 because my first video was all about the symptoms nobody talks about, the ugly truth, and you know, most ugly symptoms that I experience is I can honestly sit here and this is very personal, but it's the truth. I can honestly sit here and say my personal sex life will never be the same. It's recovering and it's getting better, but for a fact, I know it will never be the same what it was before, and that's messed up. But I also know for a fact that other people have had even worse experiences and can't even enjoy their personal sex life at all, you know? So I know it could have been much worse. Now that's just one of the symptoms that I open up in my first video. But I mean, there's so many things that the doctors simply don't warn you about, you know? And this is not for the women that had a good experience and it was easy breezy, beautiful. I'm happy if you had the Leep procedure done and you did not experience any of these ugly symptoms, not feeling like yourself, depression, feeling like you were never going to be the same, feeling numb inside. This video is for the people that had a bad experience afterwards, you know? And it's one of those things that over time, things do get better most of the time, you know? But it feels very isolating when you go through something that your doctor, quote unquote, says is very non-invasive, but then it turns out to be something that lasts for weeks and months and turns out to be quite emotionally and taxing to the body, you know? So that's why I'm making a part 2. It's almost gonna be a year since I had this procedure done. Thankfully I've been testing negative ever since, but I actually have my follow-up. Once you're high risk, you pretty much get tested every 3 months or 6 months, depending on your doctor. Regular people get tested every 2 years. They go to the doctor for their pap smear and whatnot. But long story short, once you experience this and you have to go through this experience, and there's other lovely women who had to full-blown remove all their reproductive systems or had radiation or chemotherapy, you know? So once this happens to you and you have to go through this process of having to go follow-ups and having to go to places that literally are called women's surgical cancer or women's cancer centers. I mean, literally those are the places you have to go into in order to follow up for these things and take care of yourself and take care of this, you know? So hopefully it won't progress into something really big and ugly. But once you go through this experience, it's always in the back of your head. Every time you go to the doctor to get tested for your pap smear, you're like, am I gonna be positive? What's gonna happen? So it's something you just kind of have to live with, you know? It's literally worrisome for the rest of your life. And I'm pretty sure once you test positive for once you test negative for a couple of years, maybe that fear lessens up. But it's unfortunate that us as beautiful women, we have to go through so much, you know? And it's kind of like it's the new normal. I wish this wasn't the new normal, you know? So for now, I've been negative for a year. I'm gonna have a follow-up in a couple of weeks, and it's always in the back of my head of what if, you know? And it's scary. So that's why I'm making this video. Basically, for me, this video is very important because at least if you do test positive for HPV or have to have the Leep procedure and you go on Google or you go on YouTube trying to figure out what to expect when expecting this surgery or this procedure, or what happens when you test positive, at least they can relate. At least they know they're not alone. After my procedure, I felt so abnormal. I felt like an alien. I felt dead. I felt dead inside, and it was really scary. I didn't know what was going on, you know, and I had no idea that it was because of this. So I'm sorry, my hair is bothering me. Someone called minimally invasive procedure was the culprit for it, for all these things, you know. So my hope is that at least this video will reach a few people at the bare minimum. I don't care even if it reaches only one person, one beautiful woman out there. She'll know it's okay and it's normal, you know. Just, you're not alone, you know. And it can be really scary. Some people, they continuously test positive, and sometimes it does become cancer, sometimes it doesn't. But it's a mental thing that, okay, well, I guess I won't have sex for the rest of my life, you know. And it shouldn't be like that, you know. The more you know, the better well-informed you are to make your decisions and choices. And it's just a very personal thing that I think a lot of women go through, and it can feel very isolating at times. And I think it's important to know that you're not alone. A lot of, especially when you get this procedure done, a lot of the times you have a lot of symptoms that are very unexpected. The bare minimum, you can know this is normal. This has happened before, and more than likely you will get through it, you know? And that's basically why I'm doing this part 2. Anyway, so comment below what you thought about this video, or if you can relate, or if you're in that phase where you tested positive and you're scared or you don't know what to do, or if you're expecting to have this procedure done in the future. Comment below, see what your experience was. I really truly hope that it was much better than mine, or much better than any of the women that I featured in my first video, their testimonies. And that's all I got for you. Thanks for watching, and I'll see you guys in the next one. This was very personal and hard to do, but I just felt like I needed to.